What are the causes and risk factors of leukemia?
There are a few causes and risk factors that leads to the development of leukemia. The first thing that we can identify would be due to genetic and cellular factors. For example, where there is an abnormal chromosomal or molecular development. So this leads to the production of abnormal cells. The next causes or risk factors would include inherited conditions. We have got some congenital diseases that basically leads or increases the risk factors to develop leukemias. For example, in patients with Down syndrome, there is always an increased incidence of developing acute myeloid leukemia. The other risk factor of the development of leukemia is also due to environment factors. For example, when patients are exposed to any form of radiation therapy in the past, and also exposed to previous cancer therapy, whether it was for the solid cancer or even liquid cancer that they had been exposed to in the past, and they now can develop a secondary cancer, which basically can be leukemia. Other environmental factor could be patients exposed to chemical. So some patients, due to occupational, exposed to high toxic chemicals such as benzene, which sometimes can lead to the development of leukemia. Acute leukemias are also due to a weakened immune system and also having a strong family history of malignancy. So when patients have got conditions where they have very weakened immune system, for example HIV or autoimmune diseases, there is always a risk of them developing acute leukemias. Other risk factors, for example, gender and age. So there are certain leukemias that are more common in male as compared to female, and also in the younger age group compared to elderly patients. For example, in patients who are in the younger age group, the risk of them developing ALL is more common. As compared to adult, they are more common to develop AML, acute myeloid leukemia, and also CLL.